My name is John Bedwinek, and I am a radiation oncologist. At MD Anderson, it was a large cancer hospital, and back when I was in training, it was probably the place to go if you wanted to be in radiation oncology. The guru of radiation oncology was there, Dr. Gilbert Fletcher, and so that's where I went. We have at SSM the whole gamut of cancer treating technology. As a radiation oncologist, we use a lot of fairly fancy technologies. The majority of patients are treated with conventional radiation, which is done by linear accelerator, but for certain situations we use what's called stereotactic radiosurgery, and that's a way of delivering an extremely highly focused dose of radiation to a very small area. And you can do that and spare normal structures that are within millimeters of the tumor. And the CyberKnife is it's a very elegant form of stereotactic radiosurgery. It can do what other radiosurgery units cannot do. It actually moves with tumors. For instance, if we're treating a lung tumor, it has a way of visualizing that tumor, and the linear accelerator is on a robotic arm, and so as the patient breathes and that tumor moves up and down, as the CyberKnife is treating, it moves with the tumor. We use image-guided IMRT for prostate cancer. We do radioactive seed implants. We've been doing those for years. We have a unique situation where the medical oncologist, the radiation oncologist, and in many cases the surgical oncologist are all together, not just under one roof, but in the same workspace. So a patient comes in to see me and I have a question. At the next view box or computer is Dr. Wilkes, and I say, hey John, what do you think of this case? And so we get sort of a curbside consultation, and he does the same with me. That's what makes my practice fun, is the collaboration and the collegiality. I don't think that there is a single patient that I see that hasn't been seen or consulted by the medical oncologist, and vice versa. And this makes it nice for the patients too. It used to be they would come to my office and get radiation, go to another office and get chemotherapy. That doesn't happen anymore. They go to this beautiful place that looks out over the lake. They get their chemotherapy. In the middle of the chemotherapy, our therapist will call them and they'll come and get the radiation, drag their little IV pole, come back and sit down and finish their chemotherapy. So they just have to go to one place. The patients like it, and I like it. The people that we are trying to cure, and we sometimes put them through some very difficult regimens. The combination chemotherapy and radiation for head and neck cancer is rough. We nurse them through that, but boy, when you see them back 2 and 3 years later and there's no evidence of cancer and you know that it's not going to come back, that's also a kick. I like that.